So as our sector continues to grow globally, the importance of advocacy for us just increases. And in particular, we are out there talking day in and day out with policymakers around the globe, with regulators, with payers, with journalists, to really get the word out on the fact that our sector needs to have innovative payment models that keep up with the innovative therapies that our developers are creating. So for example, all of us are very much used to, in the old days, kind of a fee for service model where you see a medical professional and you pay for that service. After that, of course, we all sort of transitioned into managed care, where we were trying to keep prices down and maybe have one medical professional coordinating a lot of our medical care. With cell and gene therapies, because these are durable and in many cases often curative, what we need to be able to do is find a model that's as innovative as the therapies are, and to be able to pay for some of the higher upfront costs that are associated with these cell and gene therapies and advanced therapy medicinal products, as we would refer to them in Europe, and have less on the back end. So that is, in contrast to typical drugs and therapies that we've been used to all along, tend to treat patients for a very long period of time, sometimes even over a lifetime. And the contrast then is with these durable therapies, you might have to pay a little bit more upfront, but then you're not going to be paying anything or very little on the back end because they're going to be used for a much shorter period of time, maybe one administration of the therapy or two or a handful, but certainly not a lifetime of taking drugs, so to speak. So very different types of therapies, and that requires very different payment models. Some of the models that we're advocating for around the country, in the US, and then around Europe with the member states, and even further around the globe, include annuities. So you pay X amount per year, sometimes a Netflix, so to speak, subscription model. Or how about pay for performance, where certain clinical milestones have to continue to be met in order for the payments to continue. I think the really important point about this is that developers are willing to put risk into the game, so to speak. They're willing to say, unlike traditional methods, we do not need all of our money up front. We are in this with you, and we will work on payment models that work for you, but most importantly, so we can get access for patients as much as possible and to increase that around the globe.